After moving forward in this fight against a deadly virus, Mayor Duggan does not want Detroit to take steps back. Southfield, Ingrid Kelly, Fox 2 News.
I think it's going a little too far.
Whitmer announced the news on Friday. Effective today, everyone in Michigan is required to wear a mask in every enclosed space. You must also wear them in any outdoor setting where social distancing is not feasible, all because of the COVID-19 pandemic.
It actually doesn't bother me. I'm a nurse, so I wear them 12 to 16 hours a day, so it's kind of second nature to me at this point.
For me, it's a pain in the butt because I do wear hearing aids and they tangle up in my hearing aids. So it's a pain for me.
Rich says it's also hard for him to understand what people are saying when they're talking because he can't see their mouths.
I think it's ridiculous. I think it's unconstitutional. I don't think she has the authority to do it, and I'm not in favor of it.
But the governor says her executive order is based on science, a preventative measure to slow the spread of COVID-19. Every region in the state has been seeing an uptick in cases, and after months of strongly recommending people mask up, Whitmer now leaving nothing up to question about where the state stands on face masks. Those who violate the order are subject to a $500 fine, and businesses can now refuse entry or service to people who refuse to put on a mask.
I've seen way too many people in stores without a mask that aren't social distancing, and I'm 65, and I've got 10 grandchildren, and I don't want to leave them without a grandma. But today, I have not seen one person without a mask inside.
Margot and Jim have been wearing homemade masks for months, and they're having fun with it.
That's one of his old shirts that he loved, so he said, I want one out of this shirt. So.
In Saline, Camille and Mary, Fox 2 News.
We are near the corner of 9 Mile and Woodward in the city of Ferndale, a very popular location where you have businesses side by side. And here in the city of Ferndale and elsewhere in the state of Michigan, starting today, you will be required to wear a face mask whenever you walk inside any establishment. That is a mandate that went into effect at midnight. This is based on the executive order Governor Gretchen Whitmer signed last week, making it a mandate for people to wear a mask inside every establishment to stop the spread of coronavirus. Also, for outdoor situations, if you are not able to maintain 6 feet of social distancing, you will also be required to wear a face mask. Violators who do not comply can face up to $500 in fines. Business owners, managers, they have the right to deny entry and or service people who do not comply with this new mandate. We spoke to a local business owner here in the city of Ferndale about the new rules.
I think it's a great thing. It should have been done a long time ago. We have been doing it for quite a while now, and if they don't have a mask, they're not coming in. And we have very little resistance. People are complying with the new mandate, and I think it's great. And I like Governor Whitmer, and she's doing a great job as far as I'm concerned. And we're doing the best we can, like everybody else.
You just heard from a longtime business owner here in the city of Ferndale, Joel Fisher, who owns this neighborhood discount store, and he is being very true to his word. We were standing over here across the street a short time ago, and we caught two people walking to the front door looking to get in to pick up their items, and they were not wearing a face mask. The employee at that discount store politely said, no, you have to go get your face mask. They walked right back to their car a few steps away, got their face mask, and then were able to go inside. It's just a common sense reminder, if you will. Starting today, if you're going to be out and about, just have that face covering, have that mask with you because it's a mandate going forward. Also, the governor touched on stopping the spread, or at least slowing down the spread of coronavirus. Here in the state of Michigan, we're a lot better compared to other states, but the governor's also focused on school this fall. That's a very hot topic going forward into the fall season, and she wants to be able to reopen school more so on a full scale as much as she possibly can. Therefore, she is hoping this mandate and that people will follow the mandate could help get her closer to that goal for all of us. Again, if you're going to be out and about, wear your face mask, wear your face covering. When you go inside an establishment, that's really what it comes down to. In Ferndale, Josh Landon, Fox 2 News.
To mask or not to mask, that is the question that so many people are asking, and it is a controversy across the country. Certain groups doing it more, other groups not so much. Let's get right to Caben Clausen. He's a data analyst with TruePublic.com. And Caben, always good to see you. Thanks for joining us. Let's talk about young people, because I know that this has a lot to do with them. What are you finding?
What we're seeing across America is mask adoption is booming. And what's happening is social pressure has really taken over. Whereas before, a lot of young people were wondering if like their friends were going to wear masks. And now as they see more and more of the majority of young people starting to wear masks, it's creating a social pressure where we've seen the numbers change dramatically. Just 6 weeks ago, only 17% of young Americans were wearing a mask, almost always. Today, that's up to 56%, and the trend line has been exploding all across America.
Wow, 56%, that's a pretty big number. Let's talk about the region and the states. Break it down for us in terms of what we're seeing demographically.
So in places like actually Michigan, Illinois, New York, California, we're seeing higher mass adoption than places in the South, like Mississippi, like Florida, Alabama. And once again, like much else in life, there's a political divide that's affecting mask adoption. But the main story here is masks are finally catching on with young Americans, where it's becoming a peer pressure situation almost, where it's like, if 9 out of 10 of your friends are wearing that, are you going to be the one person not wearing a mask? That's what's happening.
And then, Caben, there's quarantine fatigue, something that we obviously have heard before. One group in particular, again, being affected by this more than others.
Yeah, quarantine fatigue is the right word. We've seen a dramatic shift. So for most of COVID, we've been asking a question, how concerned are you about coronavirus? And the answer for people saying they're extremely concerned has been in the 40s to 50s. So 4 out of 10 Americans have been saying, I'm extremely concerned about coronavirus. That completely deteriorated over the month of June. Now just 1 in 10 young Americans are saying they're extremely concerned about coronavirus. What's happened here? On True Public, we're getting a lot of interesting comments, and one of the main ones has been, they're just fatigued. They've been so cooped up for so long. Once they got the taste of freedom, once a young person in this country went to a restaurant or a bar or that first party, it's really hard for them to go back. And that's going to be the big question facing officials across this country, is trying to put people back into a situation they were already dying to get out of.
Caben Clausen with TruePublic.com. More data on your website. Interesting stuff. Thanks for joining us.
We are alerting consumers to please don't give in to this.
At first glance, it has a Department of Justice seal, a warning from the ADA, and the promise of a fine for denying access to the non-mask wearer. The problem is, it's fake.
Don't buy them online. You're exposing yourself to be a victim of identity theft.
With the Better Business Bureau, Elma Galvin says the cards have been advertised online for about $50. And by buying the laminated document, she says you may be losing much more than cash.
Keep in mind that when you're ordering this, what the scam artists are after is your personal information along with banking information.
If you take a closer look, the card has misspellings like an extra S in poses. It also uses the wrong names for the Americans with Disabilities Act. And even though some may think the Freedom to Breathe agency sounds like a legitimate organization, the DOJ says no way.
Department of Justice is not behind this.
And while there are people who have legitimate medical exemptions to not wear masks,
it's like if there is a newborn baby, babies which are less than 2 years of age should not be wearing masks.
Dr. Preeti Golecha says for the majority of us, face coverings are our first line of defense against COVID-19, coupled with social distancing and consistent hand washing.
Again, it doesn't block your oxygen supply, it doesn't block your carbon dioxide exchange, it just blocks those droplets coming out of your mouth.
The Better Business Bureau says if you encounter these posts, take a screenshot, then send it in to the Better Business Bureau, then send it in to the BBB as well as the Federal Trade Commission so they can investigate. Erica Erickson, Fox 2 News.
We're just trying to follow the rules.
It's really that simple for the owner of Genuine Toy Company in downtown Plymouth, Elle Dare, during this pandemic.
We don't want to spread the virus. We want to help stop it.
In business on Forest Street for nearly 11 years, Dare says, of course, the stay home, stay safe order hit them hard, like so many small businesses.
We were able to open for curbside, phone sales and curbside pickup.
Dare posting photos of items and pricing on the company's Facebook page while trying her best to abide by CDC guidelines and the governor's mandate. Dare deciding to require customers to wear masks at all times. And for those who can't or don't prefer to wear a mask,
we still offer phone sales and curbside pickup. We've even held up things to the window for people to look in. Say, do you want this one? Do you want this one?
But Dare says a couple of weeks ago, she started getting bombarded with negative comments after pages like this one popped up. And here in Michigan, even a list of businesses to boycott because they require face coverings.
We started getting messages on our Facebook page that just got really out of control. The messages were coming in, all night long, all day long, saying that we're going to sue you, all kinds of crazy stuff. It's a toy store. You don't want to go to a toy store Facebook page and see a bunch of ugly stuff.
Dare says the harassment online lasted about 4 or 5 days. She had to constantly delete posts and ban users from her page, but almost instantly.
It actually had the reverse effect than they were looking for.
Messages of support from across the country flooding the company's Facebook page. Regular customers stopping by to show their support, and even new customers popping in to buy a toy and to say they agree with Dare's decision.
People are saying, I'm going to use the list to support these businesses because I know I can shop safely.
So what does Elle Dare say to those internet trolls?
Thank you. It's been great. Thank you.
In downtown Plymouth, Erica Erickson, Fox 2 News.
There's a lot that we're dealing with related to the coronavirus, and rightfully so. But it was an opportunity to reflect on some achievements that we've achieved in Florida recently, particularly with our teacher pay increase, putting Florida in the top 5 for average minimum salary, and also expanding scholarships for low-income kids. So we're proud of the work that's been done, and obviously we want that to make a difference in the future. I know a lot of parents have a lot of angst about just the situation generally, and then of course what's going to happen with the school year. And I know we have 67 different school boards, school districts, all looking at their particular circumstances. For me, one of the core principles is, parents need to have the ability to opt for the type of learning that they think is important. And so if they're more comfortable in a distance learning environment, then they obviously need to have that choice. I know there's a lot of different issues relating to how the schools will operate. And obviously we see the epidemic have a different shape in different counties, different regions of the state. But the parental choice, I think, is really the core component, because ultimately it's the parent that is in the best position to make decisions for their children. And so I reiterated that to the Board of Education and also instructed Commissioner Richard Corcoran on that accordingly. And I think it's very, very important. I was in Miami-Dade County yesterday meeting with a lot of the local officials, the county mayor, and then a lot of our municipal mayors. Miami-Dade's facing a tough challenge in terms of some of the rates at which people have been testing positive, some of the emergency department visits, the hospital admissions. But I think working together on a local level, collaborating with the state, and then also working with our federal partners, we'll be able to meet the challenge. And my view is we'll all work together. The state is going to continue to support the county as best we can. We have already sent additional healthcare personnel down to Miami-Dade County. A lot of those hospital systems, they have capacity to do a lot more if they need to in terms of having bed space. A lot of it is just personnel, and people need to have more personnel. So we've already done 150 to one of the systems, and we're having more go down there, and I think it's really, really important. We also at the state level over the last week or so have set up 4 new retail-based testing sites. So these are sites that are a little bit different than drive-through. One of them's at one of the malls. You go in, you can get swabbed really quickly and be able to get a test result. So we're going to continue to do that. I think Miami-Dade, we calculated it yesterday when I was down there with the county mayor, and I think 16 or 17% of the county population has taken a test during the course of the pandemic. So we want to continue to do that. We are, as a state, testing at an incredibly high clip. It's been roughly 90,000 tests a day for the past week. We had the one day where we did 143,000 test results. I think that was the results that came in over the weekend, and that's important. Obviously, when the epidemic started, particularly with a lot of the states that had the more severe outbreaks, they were doing a fraction of that. They were doing 10,000, 20,000 tests a day. We are capturing a lot more of the infections that are out there and providing folks the opportunity to get tested, including many of these people are not symptomatic. But one thing that I think is clear is we need to get these testing results back in a timely fashion. The state at the drive-through sites has set up relationships with some of these commercial labs, and when we went into the expansion of testing at the beginning of May, our request was a 48-hour turnaround from the time the swab was received until the test was run and then reported back to the person whether they were positive or negative. And we've had some labs who have done well, but many have not. And so the Department of Emergency Management is going to shift business away from labs who have failed to produce results in a timely fashion. If you have somebody go through one of the sites and then they get a result back 10 days later, that is not really going to be very helpful. So we think it's important. And so the state, when we're sending these tests away to the commercial labs, those who can produce are going to get more of the business, and I think that's the best way to go about it. We're also going to be debuting on Friday symptomatic lanes. So for people that have symptoms, there's going to be lanes at drive-through test sites at the Hard Rock Stadium in Miami-Dade, at the War Memorial in Broward County, Orange County Convention Center, and the Regency Square Mall in Jacksonville. Those will be lanes where if you're symptomatic, you go through, you'll be able to do a self-swab, you'll be able to send it to a lab that will turn it around in a more timely fashion. And so this way you're getting the results back, we hope within 72 hours instead of 7 days. And I think that will help people with their peace of mind, but it's also just more effective in terms of if you have to isolate somebody, they need to know whether they're positive or not before it makes sense to isolate them. So we are very, I think, cognizant of some of the delays that we've seen at these labs, and we're doing our best to shift into those labs that are going to produce better results. We continue to make really good progress on testing, the routine testing of our staff that work at our long-term care facilities, which of course house our most vulnerable residents in terms of the coronavirus. We've now done, this is our first round after we had done the staff and the residents during April and May and the beginning of June. So we now have 122,000 test results back from staff, 2.79% positivity rate, which is actually much better than what we're doing in a lot of parts of the state. So we're actually happy with that. But we're doing this because you have so many people who get infected but don't develop symptoms. And so anytime someone goes to work at a long-term care facility, they are screened pursuant to state regulations. Have you been in contact with anyone who's been infected? Do you have a fever? They take the fever. They do all these different things, take the temperature. Well, if you're asymptomatic and you haven't had any obvious contacts, then you're going to be able to pass the screening and go in, but of course you could potentially spread that. So there was, we recently identified an outbreak at an LTC in North Central Florida. 50 staff members, I think all of them asymptomatic, tested positive. At that point, the Florida Department of Emergency Management dispatched 23 staff members. Florida Department of Health was on scene to be able to pick up the slack there. But this is kind of the exception where you have that type of spread amongst the staff, but we are finding examples of 1 or 2, sometimes 3 or 4. If you're testing every 2 weeks like we are, you're going to be able to identify more and more of those before it spreads widely inside the long-term care center, and that really is the name of the game, and that will absolutely, if you can prevent outbreaks there, will absolutely save lives. So we appreciate that arrangement that's allowing us to do that type of testing. We're also continuing with the antibody testing. We opened it up recently on our antibody sites, that some of our big drive-through sites. We had been doing first responders and healthcare workers, and they obviously can still do it. We're now saying anyone from the general public who wants to do it. And what we've seen is we've seen a pretty significant increase in the percentage of people testing positive for antibodies over the past week, pretty much hovering about 10%. which is more than what we had seen. And you figure these antibody results really are probably reflecting infections that have happened 4 to 6 weeks prior, typically. So that's actually a good sign to see more antibodies, because that creates resistance in terms of the ability for the disease to spread. We're also working really hard to support our healthcare workers, to support our hospitals who are caring for folks who are ill. The capacity in terms of beds, as I mentioned, is strong. It really is the personnel that is going to be the key. So I mentioned some of the people that we're deploying to Miami-Dade. We're going to be deploying over 1,000 people throughout the state very soon. We have the capacity to potentially up that to 3,000. I also had a discussion today with the VA secretary. They have resources and we're offering different things. And I said, look, the personnel is really what we need. So we're going to be working with them to get some of their medical personnel to help supplement. It's been a long road for folks in the medical profession. This became something that was very earnest in March. We went through March and April. You know, it was a little quieter in May for the general public and the beginning of June. But during that time, I mean, you had transfers from long-term care facilities. You had a lot of stuff going on in these hospitals, and now obviously the pace is picking up even more. So it's really important that we do everything we can to support them. We also have a request that we think will be fulfilled in the near future from HHS for additional staffing, and we welcome that support. We are also up to 15 COVID-only nursing homes that have 1,000 beds available, and then we have 9 sites that are going to be on the way very soon with 600 beds. And this is really, really significant, because our policy from the very beginning has been you can't discharge from the hospital a resident of a long-term care facility who is COVID positive and contagious back to the nursing home, because obviously the fear is that that will infect other vulnerable people. And so what happens is you end up having folks who are infected, they're in the hospital, but they are medically stable and really don't need continued hospital care. These facilities can serve as a step down so that the hospital can safely discharge a COVID positive long-term care resident to a COVID-only nursing home. Once they clear the disease, then they can go back to their original nursing home. You can also use it on the front end, that if somebody tests positive in a nursing facility, they can be transferred to one of the COVID-only facilities. If they don't need hospital care, this is a place where they could do. So that's going to be 1,600 beds in various parts of the state. We've got a lot of them in southern Florida, and I think that'll be really, really important. You know, if you look at the hospital census for folks with COVID, you do have a number of these folks who are in, who really aren't seeking or needing continuing medical care, but they haven't yet cleared the disease, and so they're not going to be discharged back to the long-term care facility. The facilities we have been accepting a lot of transfers. We're going to continue to do that, but I think that that's really an important tool when it comes to protecting the most vulnerable among us. You know, our guiding principles are, number one, protect the vulnerable. I think we all have a responsibility to look after folks, particularly 65 and up, who we know now are more susceptible to really negative effects from this virus than folks in other age brackets. If you are in one of those age brackets, 65 and up, or if you have significant underlying medical conditions, you really should be limiting your contact outside the home, sheltering as much as you can, and certainly avoiding close contact with people who are not part of your household. This virus is circulating amongst the community in many parts of our state, particularly amongst folks who are in the younger age groups. So you have a lot of 20, 30-year-olds. We're seeing this, a place like Miami-Dade, you have a lot of the young people have gotten it, but it has spread to some of the older population, and I think part of that is family gatherings, friends, things like that, in multi-generational households. So folks should be very, very cognizant, if you're in those groups, to take the necessary precautions. And if you're not in those groups, you have a responsibility to look out for folks who may be more vulnerable to this virus than you. We also are recommending that folks avoid what we've called the 3 C's, closed spaces, particularly with poor ventilation, crowded places, and close contact settings, particularly a close contact setting for an extended period of time. And that's why the #1 source of outbreaks has been the home, because you're under the same roof, in an enclosed setting, usually in close contact with family members for an extended period of time. Facial coverings are recommended, especially if you can't physically distance. And you have some folks working in certain types of industries where they can't always maintain the 6-foot distance, but that will potentially reduce some of the transmission. So those basic things, I think, will really help us turn the corner. There are some positive signs in terms of, we've heard a lot about the number of cases. We are seeing some positive trends in different parts of the state on positivity that's declined in some key areas. We're seeing some other positive trends on some of the ED visits declining for COVID-like illnesses. But we've got a lot more work to do, but I have no doubt that we'll be able to do it. And it's going to be done by just having a steady resolve, not being fearful, but just understanding what's out there, understanding what we have to do, and understanding that we'll be able to get the job done together. So we're going to be working hard, to get the supplies, to get what people need. We're also going to be working hard, talking with folks throughout the state about some of the way forward in terms of businesses, schools, and all the important things that are so key to our daily lives. So thank you. Thanks everyone for doing their part. And with that, I'm happy to take some questions.
Yeah, Governor, in the last 24 hours, there's been some, the Department of Health has had to retell labs what results they're supposed to submit, both positive and negative. That's one of about a string of, I'm guessing, 5 or 6 things that have gone awry at the Department of Health, from press releases being recalled to having fights over data with some of the newspapers. Do you still have confidence in Dr. Ripke?
Oh yeah, no, of course. And first of all, with the lab results, just understand what happens. The law requires for reportable illness that if someone tests positive, it's reported. That's kind of the underlying law. We then said, I think in one of my executive orders, report the negatives too. And that's how we look to see percent positive and try to evaluate. And there were a number of labs who were just simply doing kind of what the default is, which is sending the positives only without sending the negatives. And so I don't think they were trying to be underhanded, those labs. I think that's kind of what they were doing before this started. And so that was identified. I know they're going to start doing the negatives as well. So I don't think that was an issue with the Department of Health. I think it was more of an issue with the labs. Yes, sir.
There are some hospitals, I spoke with a hospital earlier, who has been reporting positive and negative case results this entire time, and they've seen discrepancies on that spreadsheet where one week their positive cases were missing, this week their negative cases were missing.
Which hospital was that?
It was Lee Memorial, and on top of that, Lee Memorial is listed under 8 different names throughout that spreadsheet. So they're going through trying to figure out, and for another example.
Yeah, no, I know Lee had one entry where they had pretty much only positives, and then they had kind of a bigger entry where they kind of had the negatives and stuff. That may be one of the reasons why Lee has always had a little bit higher positivity than kind of the other places in Southwest Florida. But I think, understand, this is labs using the Merlin system to put it in. So somebody like the Department of Health just didn't put that in. Somebody inputted it that way, and that's just an issue. I mean, we're doing now 90,000 tests a day, so these things are being put in, and it's a huge amount of volume, and so we understand some of the labs, it doesn't always get reported as soon. And that's also why you look at like some of these test results, because sometimes it takes a long time to report them. In some ways, they're kind of a lagging indicator, because if I get results today and I see a case, that's somebody that very well may have been infected 2 weeks ago at this point. And so that's just something to keep in mind. So but we understand that, and that's just kind of the nature of when you have all the data coming in from all these different places, you got to do the best that you can. I think the percent positivity is a pretty good indicator, but you do have to weigh that against the fact of maybe not all the negatives are there. I know some of the major labs, particularly in April and May, they were submitting the positives quickly, and then they would dump the negatives. So if you look at all our testing, the ramp up as we got into May, there was 1 week where there was like way more tests than we had ever done. And then we went down and then built back up. And that wasn't because we did more tests that week. It was because they had been having for 6 weeks negatives, and then they dumped all the negatives. And so I think that day they dumped a bunch, we had like a 0.6% positivity. Well, that really wasn't the true number because of how the data was put in.
So to be clear, you do support Dr.
Oh yeah, no, absolutely. Yeah. That's not his fault for the data entry stuff.
Dead from coronavirus today. That totals about 4,500 in the state. Senate Democrats had a meeting today, and they want to know how many more people have to die before you consider scaling back on your reopening plans.
Well, we're working hard every day to prevent not only the deaths, but obviously significant hospitalizations. I think if you look at all the efforts that we've done to protect the most vulnerable and compare that with some of the other states who did different policies and maybe didn't put as much emphasis on that. And we've had people from the Florida Healthcare Association, some of them say, we've been able to save probably thousands of lives when you look at all the efforts to protect our residents of long-term care facilities. And so it's something that we take very, very seriously. We're doing all we can because every life counts, and it doesn't matter whether you're 10 years old, 30 years old, or 90 years old. We want to be there and do the best we can to help folks, particularly those who are the most vulnerable to a nasty virus.
Back to school issue. I'm wondering, do you expect that the Department of Education is going to provide to local counties some protocol when it comes to what happens if a child tests positive? Who gets isolated? How all that, the mechanics, the testing of children. Is that all going to be part of the...
So I think what the department's doing is working with the State Department of Health, and then obviously each district working with their county health department on those protocols. I think as we get through this period in terms of how the testing is going to work, I think we'll have to make some decisions just generally about, because here's, when you test healthy people, especially, which we're doing now a lot, and you go get tested, and you actually are negative, right? But then the lab gives you results 7 days later. You may have been infected in those 7 days. And so in some ways, a negative can be a false sense of security. So clearly, if anyone develops symptoms, we want to have the ability, to do a test. I think that that's very, very useful. I am not sure that just saying, hey, test on the first day of school, oh, you're good. It's not like it's an antibody test. This is a snapshot in time. And as we know, even though I believe that the younger kids in particularly, seem to be more resistant to this, the fact is, you're probably going to see different transmission as this stuff goes. But yeah, I think the health has got to be very paramount, and I think working kind of with and I don't think it's going to be uniform throughout the state. I think you'll see different localities approach it in different ways. Well, I think that's a very good question. Typically, I don't know that we would be able to just force you, to take tests. That's why I think if you're symptomatic and you're sick, then that's probably a different question. But I do think that there are probably some issues. When we do the long-term care testing, we do not require, we offer it to the residents, but you have some that just don't want to be tested. We do not force them to be tested. Now, we do the staff and make them do it, but they're regulated as part of working in these facilities, so it's a little bit different. But I do think that there are significant issues with that, but I think that those are things you're going to have to work out. But clearly, if you're doing it with folks who are symptomatic, then I think it becomes something that's probably going to be easily defensible.
And what kind of course corrections do you think need to be made?
Well, look, I think that you're seeing that. Remember, when we were going through this in March and April, a lot of folks were focused on, what is being restricted or shut down or all that. And I think if you look at it, most of the behavior was changing before a lot of that was happening. And I think what we've seen recently as the cases have risen, as it's become more of a center stage issue again, is we're seeing changes in mobility data. We're seeing people do the social distancing. We're seeing folks who are vulnerable making the extra effort. And I think ultimately that is what's going to do it for us. I was in Miami-Dade with Mayor Jimenez and a lot of the local leaders, and they've done they were one of the first counties in the country, I think, to close. They were closed for 2 months. They had a very, I think, measured, dip the toe in the water into phase one. You know, they've had things like facial coverings. They've had different things going on. I mean, they've pretty much done, I think, all the things different people have recommended at different times. And I think it's really going to be turning the corner with focusing on these key behaviors. And that was kind of the message.
Exactly everything that you need to do right.
Well, we're working every day. I mean, so if you look at what we're doing, say, with the testing of the long-term care facilities, we didn't have the capacity in March to test every worker. As we got into May, we were expanding it. We knew we were going to finish going through with that. We knew we had the opportunity to really make an impact on that. We're working very hard to be able to support the healthcare system with all these personnel. It's very, very important. That's the number one. I mean, every person I talk to who runs a hospital, it's all about the personnel. You know, they see traffic, you know, they understand what they have to do. First of all, I think a great story is just how good some of the physicians have done compared to what the results were in March, particularly in other parts of the country. I think they've learned a lot. I think that they're using appropriate treatments that have now kind of been developed and tried over the months, and I think the results are better. So obviously, we wish this could just go away. I mean, that's just not how these things work. And so, you know, as people get infected, we hope that people can fight it off and they don't end up needing medical attention, much less hospitalization. But if they do, I think that they're in pretty good hands, and I think that you're in much better shape today going into a hospital in the state of Florida than you would have been in March pretty much anywhere in the country. And I think that they've done a really good job.
Yesterday we were talking about is that they felt that they wanted to see a more unified, urgent message from a statewide approach. They mentioned that some people are getting kind of mixed messages. And we heard it again today from some of the commissioners at the Board of Education, that the education order was confusing to people. Is it a good idea for you to have sort of this one size doesn't fit all approach? And shouldn't you have more of a consistent?
No, first of all, the message with Miami-Dade is consistent. You know, I'm supporting the county mayor in what he's doing. I'm supporting those municipal mayors. I may not agree with them on everything politically, but this isn't really about politics, or it's not about the typical tit for tat. We have a task at hand. When the mayor calls me, we're there to help, and we support, what they're doing. And there should be no, that is very clear. At the same time, I mean, the fate of Miami-Dade County does not rest on the fate of what Dixie County does. That's just the reality. And so I think it's served us well to recognize the diversity of the state. Now, in terms of the education, I understand the commissioner has done some stuff on that, and I think that's fine. But I mean, at the end of the day, these school superintendents have unique constituencies, and it's going to be a collaborative effort. And I don't think it's going to be just the Department of Education. I think they can recommend, but I don't think they can dictate every decision on this. I think if you talk to parents, I think the view is a little more fractured in terms of what should happen with the schools. I think, probably early June, there would probably been overwhelming say go back, because, we had low positivity, low cases, and things were stable. Now, as you've seen this, I think there's naturally concern about what does this mean for schools? What does it mean for safety? And I think different parents look at it different ways. And I think and that's going to be different in each different school district. You're going to probably have a different breakdown in Broward than you will in some of these other places. And so you need to be able to recognize that. It should not be dictated by the Department of Education. I think they can recommend, but ultimately, we want every school district to do what's best for the kids, for their education, to make sure they have opportunities to do well, and also making sure that the parents have the agency, so that if you have a school district that's offering the in-person instruction which many parents think is very important, if you have parents that aren't comfortable with that, that they have the ability to opt for distance learning. And so that is what it's got to be. But I can tell you there is going to be differences in how this operates. And actually, there should be. I mean, because if you look at Miami-Dade and what they're doing in terms of their epidemic, although we did straighten out the percent positive, I was talking to Mayor Jimenez, I'm like, you always say you're higher than the numbers I have. So I think we worked that out. So they've been about 20%. They were 16% a couple days ago, but they've been about 20%. Obviously, we want to get that down, but that's a different profile than maybe some of the other places who, it's not like nobody has seen coronavirus. Every county has seen it, but it is just different. And so I think that that's a good approach. I'm hoping that we really work and can turn the corner with Miami-Dade. I feel like most of the rest of the state, you kind of see a positive trajectory that we can get to. And that one, I think, in Miami-Dade, a lot of the Broward hospitalizations are people that actually live in Miami-Dade, and they're going to across the county border to be hospitalized there. So let's work. Understanding that there's a lot of differences and a lot of diversity, and you may see that first day of school look different in say Northwest Florida than you do in Miami-Dade. But quite frankly, I think that that's how most Floridians would want it to be. I think that they understand that. But there is a consistent message when it comes to education statewide, and that is parents have the right to choose the appropriate environment for their child. And if they want to opt for distance learning, then they should absolutely be able to do that, and that option should be provided for them. Thank you.
You gotta go outside for today. Give a speech. That was the
necessarily have any diseases, but they're uncomfortable going out in public because they're not certain where they're headed, whether it'll be masks or proper cleanliness. So we're going to talk a little bit about that today. But we're going to start right off the bat talking about our CARES Act. Yesterday at the Board of County Commission meeting, the Commission decided our initial $20 million of disbursement in CARES money is going to be dispersed. And so the first item on the agenda is going to be the Small Business Grant Program. The Small Business Grant Program, we have dedicated $10 million to the grant program, and we're going to finish up the $1.2 million that already is in the hopper and has been for almost 30 days. As that's winding down, we've dedicated another $10 million of CARES money to those small businesses. This will include home-based businesses. It will be based on a distribution on the amount of employee count, and it will not be tied to the average wage like the first one was. I know many of the businesses out there, I think the count is somewhere around 400 that were in the process of that first grant and did not qualify or did not get their paperwork in place in time. Those people and those applications are going to be handled first and foremost. So over the next couple of weeks, we'll be rolling out the second phase of the $10 million, and that will be dispersed in a $5,000, $7,500, and $10,000 increments based on what the employee count is at the business. We've also, as a county commission, committed to roll out $7 million in personal aid. This aid will be utilized for things such as making your mortgage, your rent payment, food items, daily essentials to make sure that you and your family are able to get through this crisis. So we urge you to watch the website at the county, as well as the EOC Facebook and all these press conferences as we continue to roll that out. We also want to make sure that you understand what the criteria is, so we have asked staff prior to the application coming online, which again should be in the next week and a half, to start putting information up on the amount and type of paperwork that's going to be needed. Of course, this money we are responsible for here at the county. It has to be directly tied to COVID losses and direct nexus to COVID. So this would include, items such as preparation in your business, additional costs, loss of employees, or trying to keep employees, on the payroll. This will not be subject to what you may or may not have received from a federal level, which is going to be a benefit because there are people out there that did receive PPE and other grant money both federally and state-wise. That question will be asked, but it will not disqualify those particular businesses. On the personal front, arrangements are now being made to have a process in which your mortgage payment or rent payment will be paid directly by the county, by the CARES money. And as far as the food items, they're looking at gift cards such as Publix and Walmart to be allocated to these families who are in need. We've also set aside another $3 million or $3.5 million for nonprofits. And the benefit for the nonprofits, we know that people like Harvest Time, Meals on Wheels, and many others in our community have done social work throughout the community as this has unfolded. They've done things that, quite frankly, the government either is incapable of doing or inefficient in doing. So that CARES money is also going to be made eligible to those individuals and those organizations. So we want you to continue to watch that. We've also reached out and we're getting feedback from our government partners throughout the region. As you heard us say many times, Seminole County was late to the party, as well as many other counties, in receiving this money because we fell under the 500,000 threshold of population. Other counties that were above that have already started similar programs. So we've investigated and we've vetted and we've talked to many of those counties throughout the state to understand their experiences and what they faced and what kind of concerns or hurdles they had in this kind of rollout with this CARES money. So that's a benefit here in Seminole County. We're going to learn lessons from their experience that will allow us to better seamlessly roll this program out. So I would ask you to look at the Seminole CARES portal. which can be found on the website. Again, that's Seminole Cares, and it's going to be prepareseminole.org, or you can go to any of the county websites. The front page will have a COVID banner at the top. You click on that. That will take you to many other areas which you can investigate that. We're also going to be launching a COVID-safe business website that we're inviting all businesses throughout the Seminole County area to weigh in and tell us and show us, send pictures of what they're doing in their business to help the public feel safe. In other words, they can send us pictures, they can give us a narrative, we'll post that, because we're getting a lot of inquiries from the public and saying, you know, where is a safe place to go dine? Where is a safe place to go shop? We went to X place and we saw people not wearing masks, and we saw things that we just weren't comfortable with. So we're setting up that website so businesses will have the opportunity to come in, put that information, so the public here in Seminole County can then go to it and see what those specific businesses are doing. Once that decision is done and up and running, we will invite those people who have had an experience to weigh in, as we always have, and stay in contact with our people at the EOC. And of course, as always, during this whole issue, you can always dial 407-665-0000. Again, that's 407-665-0000. That is the phone number to the Emergency Management Center, which is manned with personnel that can help you. If you're having trouble finding something on the website, if you have a general question about testing, if you have a need for guidance on what you should be doing in your business, these are areas that you can find this information in detail. So with that, I'm going to turn it over to our educational partners, Dr. Lorenz from Seminole State. Welcome. Good to have you here today.
Thank you, Chair Zimbauer. Good afternoon. I appreciate having the opportunity to share some information with you this afternoon. The health and safety of our employees, students, and the community, of course, are our top priority as Seminole State College makes plans to do a phased reopening for this fall. We did convene a safe reopening task force to develop a phased campus reopening plan with input from employees and students that are aligned with the guidelines from the CDC, the Florida Department of Health, local physicians, emergency management, and public health officials here in Seminole County, and our own emergency response and executive teams. Current plans are to host a limited number of classes on our campuses, approximately 30% in person and 70% continuing online or remotely. Those classes that are returning to campus are those that require a hands-on or face-to-face instructional component, such as our public safety programs, nursing, and others with required laboratories and clinicals. These will be scheduled and run following CDC and Florida Department of Health guidelines for social distancing, hygiene, the use of personal protective equipment, and cleaning and disinfecting protocols. The lecture portions of those courses will remain online. All other classes during the fall term 2020 will operate in online or remote formats. This, of course, means that many of our faculty and staff will also continue to work remotely through the fall semester. Everyone who is on campus will be required to wear face coverings when inside buildings and in cases when social distancing is not possible. These are our current plans. Of course, we will continue to be flexible and adapt to respond to the very fluid situation to keep everyone safe. I want to talk a little bit about how Seminole State can help our community. We're committed to the community not only in trying to stop the spread, but also in providing access to higher education, particularly for those whose education and or livelihoods may have been impacted by the pandemic. We will be holding Know Before You Go virtual information sessions over the next 3 weeks, every Wednesday afternoon and Thursday evening, starting next week, for people interested in learning about how Seminole State College can help you reach your academic or career goals. If you are a graduating senior whose fall 2020 college plans may have changed, or you're just considering staying closer to home, we invite you to take classes with us this fall. You can easily transfer your general education credits to another college or university at the end of your time with us. This is a strength of the Florida education system. If you're currently unemployed or underemployed, or if you fear that your job will not return after the pandemic, we're here to help. We offer reskilling and upskilling programs to get you back into the workforce or onto a better job or career. We have over 200 degrees and programs for you to choose from. You may have seen recently that Microsoft identified 10 careers, including IT and digital skills, that will be what they call future-proof. Seminole State offers rapid credentials, certificates that can be earned in less than 18 weeks in IT, graphic design, and public safety, as well as workforce degrees in IT, business, construction, nursing, healthcare, respiratory therapy, social media and marketing, and many more. And these are programs that could get you into a career with a future. Seminole State also offers bachelor's degrees in high-demand and high-paying fields in construction, information systems technology, business and information management, health sciences, the RN to BSN program for nurses, interior design, and engineering technology. Again, please check out our Know Before You Go virtual information sessions over the next 3 weeks. You can check the college's website at seminolestate.edu or our Facebook page to get details on how to access those sessions. I want to take a moment to express my thanks to the county commissioners and county staff for your leadership throughout this crisis. I'm also deeply appreciative of the hard work our EOC staff and all of our first responders have been dedicating to help us through this crisis, and I'm very proud to be part of such a caring community that works so well together. Thank you. And I should introduce Dr. Walt Griffin.
Good afternoon, everybody. I want to begin, we'll start with last night. Last night, right in this room, we presented our 2020 reopening plan to our school board, and the reopening plan was passed. The creation of the reopening plan involved many people on a large task force that I convened all the way back in April, who closely followed the Academy, the American Academy of Pediatrics, CDC, certainly our partners, the Seminole County Department of Health, to develop the health protocols and that very important part of the plan. It emphasized what would happen in our buildings, transportation, school day, every aspect of everything that you could think about related to the reopening of school. The plan includes specific instructional models, our health and safety protocols, campus operations, extracurricular activities, dining services, and transportation. On June 24th, the school board held their first work session related to reopening. Part of that work session was to review parent survey responses, of which we received over 17,000. At that time, Seminole County was on a downward trajectory in terms of cases of COVID. So we only had two options for our families. The two options at the time were either come to school face-to-face or Seminole County virtual school. Those were the two choices. Over time, we learned from our families, from the task force, from our students, that more choices were needed to give families more opportunities to stay home until they felt safer coming to school. So as a result of that, yesterday, prior to the board meeting, we had a 5-hour work session to introduce the rewritten reopening plan, but to really spend a lot of time talking about the options for our families. At the end of the day, the larger number of families that sign up for one of the remote or virtual options, the fewer students that will be on our campuses, and the easier it will be for us to socially distance and to have fewer teachers having to interact with such large groups of students. The 4 instructional models are very, very important. The first one, which we are required to offer, is a face-to-face option 5 days a week. This is very much like the traditional school that we have run for decades. Buses would pick up the students, or parents would drop them off, and they would spend the day in a face-to-face situation as socially distanced as possible and with as many health and safety protocols in place as possible. We added a brand new option for families called Seminole Connect. And again, this was based on what we were being told families wanted. when I met with a group of parents, a group of teachers, a group of students, all via WebEx, the one thing I heard loud and clear was, please give us more remote options, more flexibility so families can make the decisions that they feel most comfortable making. So Seminole Connect was born out of that. And Seminole Connect is our program where our teachers will teach our students over the web. And it will look different depending on the classes. And there are 10 situations where we'll actually have full class webcams that follow the teacher, follow the interaction between the students. The vast majority of the instruction will be over a computer-based webcam where teachers are interacting with full groups, small groups, individual students, whatever is needed for proper instruction to take place. The third option is our decade-old Seminole County Virtual School. Very different than Seminole Connect. Seminole Connect mirrors what we do day to day. Seminole Connect students are going to be tied to the extent possible with the same teachers they'll have when they return back to school. Seminole County Virtual School is different. Seminole County Virtual School, we have our own curriculum for that. Seminole County virtual teachers work 8 to 8. Students log on, log off when they want. Much more freedom in terms of accessing curriculum and working at your own pace. So it's very, very important. Seminole Connect is very much like our schools in a remote format. Seminole Connect will allow off-ramps at 9 weeks. So at the end of the first 9 weeks, if the situation has greatly improved, students will return to their classrooms with their teachers. Seminole County Virtual School requires a minimum of an 18-week commitment so we can wrap up the entire class in a semester. Then also we were asked to put in some options so families have some choices if they wanted to mix and match some things. So we have a hybrid model, and the hybrid model would be, for example, if a high school family feels safest keeping their children home for the academics, but still want them to participate in some of the electives, where those courses are available, parents and students could make some of those choices. So 4 models: face-to-face, Seminole Connect, Seminole County Virtual, and hybrid. And a reminder, there is an emergency order that we must offer a face-to-face option before we can offer the other options that I'm speaking about, our innovative options. So our board approved the plan last night. Now our plan, the innovative option of Seminole Connect, is already in Tallahassee for their approval and for us to get started on time. So last night after the board meeting, we sent registration materials out to families immediately. Families have until July 24th to pick one of those 4 options. We also had a discussion about calendar. We originally were slated to start school on August the 10th. Hearing from our teachers, they needed more plan time up front in order to get ready for these new remote options. So what the board was able to do and approve last night, and we did this, we worked on this right at the board meeting. We are starting school August 17th instead of August 10th, and front-loading a total of 9 planning days for our teachers prior to beginning instruction. So I covered a lot of information in a short amount of time, but anybody listening to this, all this information is on our website. All of our families received it last night. We have a very organized structure as emails are coming into the district to get questions answered and take care of all the different possibilities and scenarios that I know our families are dealing with. I think at this time I'm just going to wrap it up with the information is on the website. Thank you.
Thank you, Dr. Griffin, Dr. Lorenz. And as you can see, our school board really has been doing yeoman's work in making sure that our children have the options, our families have the options to protect, those students as they start back to school. And it speaks volumes of what's going on here in Seminole County. Every day we turn on the news and we see, across the country, areas that they're all fighting with each other. What should we do with school? We're not going to school and so forth. I think this is to give 4 options to help appease and make sure that our students are educated speaks volumes of the work that the school board has done. And thank you, Dr. Griffin, on behalf of the community. We appreciate it very much, and as well, Dr. Lorenz. You know, we have to have some sense of normalcy as this continues to unfold. Again, we're day 120. I think you've heard me say many times in emergency management situations, we're dealing with a hurricane. Maybe we're down for a week, 2 weeks, 3 weeks maybe. Never did any of us believe that would be this far into an issue that we're all dealing with. So again, I urge patience. I want to thank the media for being here today to help get the message out. With that, we'll take questions, and then we'll move to our Hispanic translation. Freddie will come up and do that as well. So we also have Alan Harris here from Emergency Management and Donna Walsh from the Department of Health. So if there's any questions that you may have for those folks, we'll be happy to take those. Yes.
Absolutely, great question. Last night, parents already received the registration form. So first and foremost is we already have done, and we will continue to do, a great communication campaign so parents clearly understand the choices that they have. So once they make those choices, we actually will capture that information electronically here at the district and then sort it by school and sending information to the school. Students that choose traditional face-to-face, they already have a schedule designed at school because we started scheduling back in January and February for 2021. Students who select Seminole Connect, we will still attempt to keep them attached to the same teachers they were originally scheduled for, but have to make some adjustments to build sections. So the main thing that will be taking place between now and over the next 3 weeks is a massive scheduling effort, because we're going to have some teachers who will have remote classes probably the bulk of the day, some who could wind up with half-day remote, but student demand is going to determine what we have. We did in the initial rollout, when we were just talking about having 2 options, we had over 3,000 families express interest in our virtual school. We're giving them the option now, if they chose virtual school, to switch over to Seminole Connect if that fits their needs better, or maybe even create a hybrid model between face-to-face and Seminole County Virtual School. So it's all about scheduling. It's all about building the sections that we have to build, offering the courses that we always offer, and then figuring out the best way to deliver those courses remotely. As all of you know, you've all been out at our many career technical programs. That's a very different challenge than our math classes. So each course is different. Each school has different concerns. So we will work with them to do the best job that we can do to meet what parents ask for and to deliver the quality that we can. Yeah. Sure. The question is, what are we seeing in terms of registration at this point now? It's only been out for not even 24 hours. But right now we're seeing about 50% interest in face-to-face and the other 50% spread among the other options. That changes hourly as they are coming in. So I wouldn't hold to that number. But at least 50% are showing interest to return face-to-face. Yeah, we already did our big kindergarten roundup, so we've reached out to all of those families. Any family who did not register yet for kindergarten or for any grade, or are new to the area, or just want to access our schools are prepared to accept them in their front offices, and we will get them registered right through the school. The biggest change that I have seen is UV lighting on some of our filters. Our facilities department has invested quite a bit in upgrading those systems. Yes, we are putting together a video to train every single employee to do something what we call visual screening. So if a student was exhibiting symptoms, normally we would have one student walk with another in elementary school. We're going to have a contact at the school who is trained, somebody on campus, an adult, to come get that student, immediately take the temperature. We have scanners available at every single school. Contact the parents, and then work with our Department of Health for any student who is exhibiting anything out of the normal for that student. That's a good. Whoop. The earlier that they make a decision, the more efficient we can be in scheduling. We will still try to meet the same options the 24th that we're meeting tomorrow, but after the 24th is where it's going to become a little more of a challenge, because we'll start putting those sections in place. But people who meet the deadline of July 24th at noon should have the same opportunity to get the same courses as people who submit today. We wanted to give parents the 10 days to make that. That's a big personal decision. And I will tell you, at the end of the day, if a family has to change a decision for whatever reason, we will also try to accommodate that where there's space available. Trying to be very accommodating and compassionate during these difficult times. Yeah, I'm worried about the health and safety of our teachers, all our employees, and our students. And I think, the push for Seminole Connect to get as many people students off campus as possible will really help us by not having those large numbers. And we'll have more teachers working with very small groups, or maybe all of their groups will be working remotely. Most of the teachers will still be working out of their classrooms, some with no students. There may be some cases where we have a teacher needs to work at home all day. We're going to try to be accommodating. Joe Rinaldi, could you come up and answer? Our facilities man is here. He could do a better job answering that than me. Right, Mr. Rinaldi.
From the standpoint of the HVAC systems, we're looking really at two specific levels. At the operational level, we're looking at expanding the number of hours that we're operating our systems. Right now, we're looking at from 10 p.m., or really from 4:30 a.m. to 10 p.m., actually running our systems to make sure that after the students leave and after staff leaves, we're actually flushing out the buildings. And then we're flushing them early morning as well, so that when they come in, we have a completely flush building, fresh air coming in. In regards to the systems, we're looking at filtration. We're identifying those systems right now that can accommodate the UV lighting and putting UV lighting retrofit kits in there. And we're also doing a test and balance, because we have a number of systems that meet the present ASHRAE codes and all that, and we want to make sure that they're running as efficiently as possible. So those are the things that we've got going on with ventilation right now. No, we're looking to get the most bang for the investment. So we're actually looking at installing them on the supply side with the air handlers. So, and then typically an air handler handles multiple spaces, multiple classrooms, so that we're able to filtrate that air and use it on a wider basis. How much? Yeah, right now we've put a request in through CARES and through the multiple agencies at somewhere around $800,000. We're looking right now. We've got close to a little under 1,000 air handlers, and cost-wise, they're right around $1,000 a piece to do the retrofit kits that we're looking at right now.
Yeah. First of all, our goal is to keep students in Seminole Connect. I'd be very specific, okay? Our new remote program. We're going to make every effort to keep students assigned to their teachers at their schools. We've already, when we schedule, we do something called sectioning. We've already built all our sections, so students on our computer system are already assigned to teachers. So what we'll have, so we already know how many Algebra 1 sections we need, how many AP Physics sections we need at every single school. As the remote requests come in for Seminole Connect, that we will start creating second sections of those same courses and then make a determination how many of those sections will be remote. Right now, teachers would know how many face-to-face classes they have from the original schedule, and then after the 24th, as we have all the scheduling numbers, that's when we'll start working on how many remote sections we have of each course. The second part of your question, classes like AP Physics, AP Physics, AP Chem, International Baccalaureate, a lot of those have singletons. Singletons mean there may only be 1 or 2 sections in the school. Those are the classes where we're going to use the class-wide webcams so teachers can interact with students in the class while students are watching at home. Well, I think there'll be a hit, but at the end of the day, safety and health are most important, so we will continue to follow the guidelines, all the health guidelines that I mentioned, but specifically athletics. We work very closely with the Florida High School Athletic Association, as well as I work with the other 66 superintendents, so we'll do what we have to do in terms of social distancing. There may be games without crowds there, but we will follow what we need to follow. Yeah, we do have an entire department dedicated to this. We never feel like we have enough nurses. Nurses are split between schools and so on. And if we need to hire additional people, get additional people trained, we'll do that. But I'll tell you, Dave, I think the important thing is that having every employee just be able to recognize the visual signs will help us. It's not saying everybody is going to be a nurse, everybody is going to be a doctor, but the awareness is very important, and then we will connect. Really, the Seminole County Health Department always comes in and helps us immediately for any type of disease that we have to deal with. Absolutely. I think that that's a concern that everybody has. And again, that's why we're really encouraging families who have any concern to consider the remote option. That's why it's there.
So for the summer term, we saw an increase of about 6.5% in our enrollment. For fall, we're still early in terms of enrollment, but our returning students are coming back. That enrollment is really strong. They're returning this fall, and they're, in some cases, taking even more classes to get closer to their goal more quickly. We are seeing a lag in new student enrollment as compared to prior years. And anecdotally, we've been told by parents and by the potential students themselves that they're slow to make a decision. In some cases, they describe that they feel like, their senior year didn't have sort of that finality that they were expecting, so they're sort of delaying their choices, but they do plan to attend. So it's sort of a mixed bag at this point, but our returning student enrollment is very strong. The only employees that have been impacted at this point were part-time employees, and in most cases they held positions that we no longer had a need for during this remote working environment. For example, we have a video game room on campus and the student center is closed right now, so that part-time employee did lose their employment. But there was a very limited group of people that were impacted. And back to your prior comment about enrollment, of course we offer one of the highest quality, low-cost options for attending college. And the first 2 years at Seminole State cost about half of what it would at university. So I don't think that that's the barrier to enrollment for most. Yes. I think in those programs, the enrollment has been fairly steady. The challenge that we faced is when we went remote in the spring, we had a cohort of students who essentially their progress was suspended, and they came back to campus on June 24th for our B-term summer session. So our numbers are a little less clear because of that odd change, but overall the enrollment is steady in those programs. For the most part, we have found a way. This summer, for example, our science classes that have a lab component, we've purchased software that has a great simulation of the chemistry lab, for example. So for the most part, we have relied on the talent and innovation of our faculty, and they have found a way, with the exception of the public safety and fire safety that we had to suspend, because you have to physically fight a fire before you can complete that program. So let me start with an employee. We are currently launching training for all of our supervisors, and that is an important part of that training. And we have a protocol for exposure, a protocol for a positive test, and steps that the employee would go through. And there are a lot of different scenarios sort of baked into those protocols. And we have a protocol for exposure, a protocol for a positive test, and steps that the employee would go through. And there are a lot of different scenarios sort of baked into those protocols.
Department of Health, as they always do, they will come out to the school and they will guide us through that. We've had this long before COVID. We've had this in place where we work with them side by side. We do have a separate room designated at every single school for anyone exhibiting COVID symptoms. We would ask the Department of Health to come in there and help us with that. The question is, would the district pay for those tests? If a family could not afford a test and a child needed it, we do have a Families in Need program that would definitely assist. It's been spoken about a lot, and we are not going to temperature check every single student walking into school every single day. But the health officials have really told us that if we really learn and really stick to this visual screening, we will know what students to temperature check. And the question is, how are we going to roll out and make sure that Seminole Connect is successful as compared to fourth quarter last year? Please remember, last year, fourth quarter, we had 6 or 7 days to pivot from face-to-face to remote learning for 67,000 students. Our teachers did an absolutely phenomenal job with the array of resources that we provided to them. Since that time, we have been building and improving upon what was then called distance learning to a remote curriculum that we have now. Teachers will receive training. The product is much who are not acting the way they usually act. You know, we are aware at schools of students who have asthma, who have chronic illnesses, but students who are acting unusual physically, whether they're lethargic, whatever symptoms that they are showing that are different, that will be reported to the office, and we'll begin the process. There's a long list that the health department has for us. And we'll share the video when that's done. I think you'll like to see that.
Well, if there's nothing else, again, thank you very much on behalf of Seminole County, our education system, and our 7 cities. One of the questions that was asked earlier was funding for the school board. I will tell you that the county commission here in Seminole County is in lockstep to do whatever's necessary to ensure that our students remain safe. If that includes funding, we have CARES money that we absolutely can assist our school systems with to ensure any shortfalls or any emergencies that may crop up. I think that we've heard that from my fellow commissioners, that we're dedicated to make sure that our children will be safe when they go back to school. So again, thank you all very much for being here. Thanks to all of our frontline responders, all of our firefighters, our healthcare people, as well as the media from here. And just know one thing. We will get through this sooner or later. Be patient. We'll find a way. With that, Freddie's going to give us the Hispanic translation. Freddie, thank you again for being here to do this.
It's been over 4 months since I first stood here and delivered the first of more than 80 COVID-19 briefings. An awful lot has happened over that time. In the last 4 months, the people of Illinois have once again proven themselves the most resilient, dedicated, and compassionate people in the United States. To put some perspective on this, Illinois now has the lowest infection rates among all of our neighboring states, between 1/2 and 1/3 of their positivity rates. Indeed, we have one of the lowest positivity rates in the country, and it's because of the individual actions of millions of our residents. Throughout this pandemic, I have always given you the facts about coronavirus, how we're doing in the battle against it. Let me begin by saying, first and foremost, this virus has not gone away. It's still infecting people, and it will likely continue doing that for months to come. But with the difficult truth comes the news that Illinois' to manage COVID-19 looks a whole lot better than it did at the beginning. Unlike in late February, we now have significantly greater capacity to test for the virus and to trace the contacts of those who test positive so we can limit the spread of the infection. Ours was the first state in the nation to be able to test for COVID-19. Now is hitting a record weekly average of more than 33,000 tests per day, crossing the 2 million test threshold earlier this week. Today, we report testing of 38,161 people. State testing is among the best in the nation, and we have tripled the number of contact tracers that we had just 6 weeks ago. In the first 2 months, our 7-day roll average positivity reached over 23% at its peak. Today, we're averaging 3%. Illinoisans worked hard to get our numbers down so that we could build back some aspects of everyday life in relative safety, moving through the phases of Restore Illinois over the last few months. For over 2 weeks, of Illinois has been in phase 4 of that plan. And while there can be adjustments to allow greater flexibility for businesses and individuals, we cannot reach phase 5 until we have a vaccine, a very effective treatment, or the elimination of new cases over a sustained period of time. That said, many people want to know if we're out of the woods and they're wondering what's next. So I'm here today to find the path ahead and make sure that we all know what will cause us to impose further mitigations. First, opening up our economy does not have to come a spike in cases. Other countries have done it successfully while reducing cases and infection rates. But that requires vigilance on the part of all of us. It's imperative that individuals, families, workers, and businesses follow the recommendations of doctors and epidemiologists, that we act quickly if we see any outbreaks and upticks, signs that could lead to a surge of coronavirus infections. Our guiding principle remains the same as it has been from the very beginning: keeping people safe and healthy. The virus is unforgiving, as we have seen in states in the South and the West. So it's important when we see trends in our data that indicate a potential problem in any region of Illinois, that we need to start tightening mitigations in the region before it's too late. The epidemiologists and professionals at IDPH have determined that we need to take action in a region if we see a sustained rise in the positivity rate, along with either a sustained increase in COVID-19 hospital admissions or a reduction in hospital surge capacities. A sustained rise in the positivity rate is defined as an increase in the 7 rolling average for 7 days out of a 10-day period. In addition, if any region hits 3 consecutive days of an 8% average positivity rate, that will require action, period. These metrics are clear. Staying under these metrics will allow us to continue in phase 4 without having to take significant mitigation steps. At the end of the day, job 1 is to keep you and all the people that you love safe. We're also today changing the boundaries and the number of health regions in Illinois. Unlike when we first introduced the Restore Illinois plan at the beginning of May, our growth in testing and tracing has given us a much more surgical ability to manage outbreaks and address problems locally. So going forward, we have the ability now to monitor and measure progress in 11 separate regions, based largely on our 11 hospital emergency medical services regions, referred to as EMS regions, that have traditionally guided IDPH in its statewide public health work. For ease of management of this coronavirus pandemic, we've redrawn some EMS regions, but less of the regions as they were. For example, the city of Chicago will be in a region of its own, as will suburban Cook County. As for the collar counties, we've shifted regions based on geographic contiguity. For example, Kendall and Grundy counties will now be in a region that is not part of the collar counties. Remember, the goal of the regional lines is in large part to make sure that there is healthcare availability. This plan lays out an array of mitigation strategies that can be applied if a region breaches the resurgence metrics. These mitigants cover categories like bars and restaurants, meetings, social events, religious gatherings, and organized group recreational activities like adult and youth sports. In each category, we have 3 tiers of mitigations, allowing us to move carefully but deliberately, depending upon the severity of the situation, to control the virus while continuing to allow a region to be open to the greatest extent possible. These mitigation options allow us to move decisively without reacting more badly than circumstances require. We're focusing on detecting and mitigating localized outbreaks by working with municipalities and counties to take targeted steps to contain outbreaks. With our new mobile testing units, greater testing capability, and increased contact tracing, local public health departments working with IDPH have been able to limit community spread in a number of those circumstances. Unfortunately, outbreaks are taking place consistently and in every region of the state. In just the last few weeks, we've had outbreaks tied to athletic camps, July 4th parties, and churches. As I said yesterday, bars remain a concerning source of rising positivity rates in various regions. As we've seen concerning trends, it's been important to me to sound the alarm with local officials who can take immediate targeted steps before we intervene at the state level. For example, I reached out to the mayor of the city of Chicago last week because of the concerning uptick in positivity rate. I'm also deeply troubled by outbreaks that we're seeing all around the state tied to activities like youth sports, like in Lake Zurich, where dozens of students and parents have tested positive in a related outbreak, and in Knox County, where a teen softball league is also experiencing an outbreak. Remember, the degree to which we can reduce risk and restore aspects of our daily lives is still unfolding. We're continually evaluating what works and what doesn't work. And we're taking a good hard look at how youth sports fits into that conversation. Let me reiterate what I've said from day one. IDPH to take immediate action there and elsewhere if trends in the data require it. Looking ahead, I know that many people have concerns about in-person learning in schools. As a parent, I share those worries. Every school district is different. Different building sizes, different flows of students across campuses, different numbers of students and teachers per square foot. Doesn't fit all. So the Illinois State Board of Education recently released guidelines for how districts can return to in-person learning. There's room for adaptation to local circumstances in the guidance, but there are some requirements that must be adhered to. For example, face coverings, distancing, and classroom capacity requirements. In every decision relating to this viral threat, schools must focus on giving our children the best education possible while offering the greatest consideration to their health and the health of their families and all of those who work in our schools. And as indicated by the ISB instruction, hybrid schedules and remote learning are likely to be a part of that solution. Parents should be fully engaged in understanding what policies each district is moving toward, and should be fully included in discussions of how to adapt to local and individual needs. But to be very clear here, any district that intends to disregard this guidance is gambling with the lives of our children, teachers, and families. Districts that don't live up to public health guidelines and standards and don't make a genuine attempt to protect their communities from this virus could be held liable in courts by community members who are ill-affected. I'm a father. I understand that parents are worried sick about having to choose between seeing their kids miss even more in-person schooling at critical ages and the very real threat of this virus. Good people with good intentions can disagree on how and when kids should go back to school. But let me be clear, I wouldn't let my own children return to a school where masks are not mandatory, and serious effort hasn't been made to keep students distanced during the day. This should not be controversial. Remember, the degree to which communities can mitigate risk and restore more normalcy to daily life in the months ahead is, to a large extent, in the hands of the people of our state. Precautions following the mitigations recommended by doctors and epidemiological experts, like wearing masks in public places and keeping some physical distance, are necessary for us to keep all Illinoisans safe and healthy. Through the pandemic, it's been my priority, shared by Dr. Ezike, IDPH, and the rest of my administration, to ensure that Illinois would not be too proud to evolve our path forward if new information encouraged us to do so. 2 months ago, when I introduced the Restore Illinois plan, I said, we can and will make this smarter as we move forward. And we're doing that today, as we have all along the way. Scientists and doctors and researchers learn new things about this novel virus every day. That fact should humble us. There's a difference between learning by questioning and sneering in the face of facts. And in this moment, as we face down a global pandemic, as our communities struggle with massive economic upheaval it has brought on, and as we renew our call for racial justice, when it comes to the unknown and the uncertain, now is a time to err on the side of compassion for our neighbors and empathy for the most vulnerable among us. On that note, I want to end with a renewed call to action. The research and science are much clearer about COVID-19. There are things that we do know, and we know work. 216 studies of mask wearing and distancing have been evaluated, and they collectively confirm that masks and distancing bring down transmission rates and the risk of infection. That is a fact. The single best thing that you can do to help our state, to help your neighbors, to help your community, is to wear a mask in public. So follow Dr. Ezike's 3 W's. Wear a mask, watch your distance, wash your hands. You can also help in another way. If one of the 1,450 contact tracers calls you, please answer. Also, in Illinois, everyone, regardless of citizenship status, who needs to be tested should go get one. Our state-run, community-based mobile and drive-through sites are free of charge to anyone who shows up. Private insurance and Medicaid-covered families can get tested at other locations at no cost as well. On top of that, anyone listening who has a device, internet connection can help too. We provide county-by-county data on the IDPH website that will allow you to monitor how your local community is doing at reducing coronavirus spread. That allows you to spur action by your local elected officials to provide additional mitigations to reduce your local infection rate and keep you and your neighbors safe. Everyday Illinoisans with an interest in ensuring your neighbor is seen safely through this pandemic can use this tool to hold your local officials accountable. Illinois, this journey has not been easy. Coronavirus has ravaged families, made many people sick, and has killed more than 7,000 of our fellow Illinois residents. Not a day has gone by where I haven't wished for a magic wand to rid our people of the pain, the loss, the trauma of the last few months. But the virus is still here. Ignoring it, trying to wish it away, is not going to help us beat it. A quixotic rush to read a shadow of our former lives today will just delay a real return to normal later on.